The following program, Know the Cause, is paid for by Pediatrician Incorporated.
We've got a great show assembled for you today, folks. A couple of doctors, my good friend Dr. Mark Stengler in the middle of the show. Going to talk about tummy problems, gut leakage, all sorts of digestive issues. Toward the bottom of the show, Randy Naidoo. He's a medical doctor, pediatrician, and he's going to talk about integrative pediatrics. What is that? I think you're going to fall in love with this guy. We just love him here. Ductal carcinoma in situ, microcalcifications in the breast. Is that really cancer? We're going to open discussing that today. And by the by, always work with your own doctor. Use me as a resource, but work with your own doctor when it comes to diagnosis and treatment. And then finally, is the PSA really a prostate cancer test? All that and more. Get ready, watch.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
Friends, it had to have been 40 years ago that I interviewed a man. His name is John Lee. He's a medical doctor. He wrote a book. I think he wrote this book after I interviewed him, but I love the guy. He was in California. What your doctor may not tell you about menopause, natural approaches to progesterone, etc., by John Lee, MD. In this book, he talks about mammography. And on page 218, he says this, because all the proponents are saying mammogram's the best thing in the world. And I'm thinking, wait a minute, you smash a breast and shoot radiation through it. Is that safe? I don't know. Another explanation for the presumed benefit of mammography concerns the question of the diagnosis of duct cell carcinoma in situ. The phrase carcinoma in situ implies finding of suspicious-looking cells scattered here and there in breast tissue, but not growing as a lump, a clump, or a tumor mass. At one time before 1992, some pathologists used this term to indicate cells they thought might actually be cancer cells in a very early stage. But since 1992, most pathologists agree that these cells do not, in fact, progress to actual cancer with any risk of true cancer. These are cases found by mammography and not by palpation that result in breast surgery, irradiation, and chemotherapy, and were counted as cancer cures by mammogram proponents. Since they weren't true cancers, these apparent cures create the illusion that mammograms and early treatment were effective, when in fact, no treatment was necessary. Just quoting John Lee, he passed a few years ago. He was a gentle man. Look at, there's his home number. Wow. He was a gentle man. I loved interviewing him. I think I did it several times. All of this to build up to what I want to talk to you about right now. Ductal carcinoma in situ, DCIS. Any woman is fearful of this. Many of you have heard it. What he contends is, pathologists since 1992 say, that's not cancer, and yet we're treating it and treating it and treating it. Is it that growth that is dangerous, or is it our treatment? Just asking. I don't have an answer for that. So let's study this a little bit. Breast cancer. Many different types of breast cancer. The type of breast cancer can also refer to whether the cancer is spreading or not. In situ breast cancer, ductal carcinoma in situ, like we were just talking about from Dr. Lee, DCIS, is a cancer that starts in a milk duct and has not grown to the rest of the breast tissue. The term invasive or infiltrating breast cancer is used to describe any type of breast cancer that is spread or invaded into the surrounding breast tissue, but you get that, right? So ductal carcinoma in situ, it's in the milk duct, but it's just some cells, okay? Next graphic, ductal carcinoma in situ. This is a headline I just saw on MedPage Today. This is a doctor's newsletter that I really enjoy. It's good, medpagetoday.com. DCIS tied to higher chance of breast cancer death. What? Black women and those under 40 years old at particularly high risk. Women with ductal carcinoma in situ diagnosed were over 3 times more likely to die from breast cancer versus those in the general population. A retrospective, that means they go back and study all these past documents. Now, wait a minute. Somewhere between this book being written, let's see what year this book was written. Somewhere between this book being written in 1994 and now, This is a deadly cancer. I don't know. I don't have an answer for this, folks. I'm not a doctor. I'm just trying to give you the facts. So if your doctor says, wow, I'm worried about that, that's ductal carcinoma in situ, get this book, What Your Doctor May Not Tell You About Menopause, page 218. Read it, take it to your doctor. This was a physician, right? Okay. This just blew me away. Here comes an article decades later. It says, boy, this is quite dangerous. Okay. What these doctors are seeing is microcalcification within the milk ducts, right? And DCIS. About 50% of ductal carcinoma in situ patients have calcium deposits growing in the breast tissue. Cancer.org states microcalcifications or calcifications are calcium deposits that can be found in both non-cancerous and cancerous breast lesions. They can be seen on both mammograms and under the microscope. Because certain calcifications are found in areas containing cancer, their presence on a mammogram may lead to a biopsy of that area. But what might cause calcium to grow in breast tissue? This is every woman's question. It would be mine. If I were a woman and the doctor said, boy, I don't like that, there's some microcalcifications. What's this mean? Well, it's in the milk duct, so it's ductal carcinoma in situ. Why do I have calcium? Is it from swallowing, eating too much milk, cheese? Am I taking too many calcium supplements? Why am I producing, why do I have these munitions factories making calcium? And folks, it goes beyond that. You know, gallbladder calcifications, stones, etc. Why is all this calcium being made in my body? Well, you guessed it. I mean, this is Know the Cause, and I'm Doug Kaufman, so it has to be fungus. Look at this. Fungus causes calcium formations. Amen. This fact has been well established in the medical literature as the cause of calcium lesions in study animals. To study certain health problems like insomnia or even Alzheimer's disease, researchers must induce those diseases or symptoms in laboratory animals. They do this by injecting or inoculating a mushroom, a poisonous mushroom extract, a mycotoxin called ibotenic acid, over an extended period of time, and the rats end up, the cats or whatever they're studying, with insomnia or with Alzheimer's disease, and calcium lesions ensue. I mean, this, folks, I wish doctors knew this. You can help me. Talk to your doctor about this. And finally, if your doctor tells you have microcalcifications, be they in the kidney or the gallbladder or the breast, talk to him or her about fungal exposure. This is pretty important stuff, folks. Know this, and now you do.
Antibiotics can induce leaky gut, but they also do it through a secondary mechanism, which I think is more primary. They create dysbiosis, imbalance between the microbiome of the gut, where we all have a certain amount of naturally occurring yeast in our gut, but when it overgrows, it becomes opportunistic.
Word has it that my good buddy from San Diego just was voted the 2023 top naturopathic medical doctor. My good buddy is Dr. Mark Stengler. Welcome to the show. Thank you so much for coming in today.
Doug, always great to be with you.
What an honor. There's a lot of NMDs out there, and you got that honor. Oh, good for you. I love having you here. Can we talk a little bit about something that when I went into this field 53 years ago wasn't known? Gut permeability, or what the research literature says is gut hyperpermeability. Do we leak?
It's a good question. And people are surprised to find out, including most doctors, there's hundreds of published studies showing, yes, leaky gut syndrome is real. This is in medical literature. There's actually lab tests you can do. I do them with patients. You can actually see the degree of leaky gut. But what you're saying is true. Basically what happens in the small intestine, where the absorption of our nutrients takes place, people develop an unhealthy small intestine from their diet, the standard American diet, too much sugar, alcohol, artificial foods, stress, antibiotics, pain medicines, you know, the medicines used for joint pain, muscle pain, soreness.
They widen the cellular gaps.
So it's right. So basically, you only should absorb certain sizes of molecules through the small intestine. But with leaky gut, you get a more porous opening, unhealthy small intestine. And so as you said, molecules too large start being absorbed through the gut lining that shouldn't be. Now, two things happen. Your immune system reacts right in the gut itself. So it can create digestive problems. And as you know, 70% of the immune system is in the gut. So now you're creating an inflammatory response by the immune system, creating inflammation, which is, you know, which happens with all chronic diseases. And then a second thing happens. They call it translocation. bacteria that should not absorb through the small intestine get into the bloodstream, go to different parts of the body. Could be your joints, could be your brain, could be your prostate, whatever, and then your immune system creates an inflammatory response where this bacteria is translocated to. So this is real science, hard science, and this is why gut health is so important.
I'll never forget, 1980, a paper came across my desk that said antigenically intact food macromolecules exiting the gut. And I took it to doctor friends of mine. Well, you know, probably don't, you know, you get nutrition from your food.
Yeah.
But we're talking about big stuff. Do antibiotics play a role in inducing this?
Absolutely. Antibiotics can induce leaky gut, but they also do it through a secondary mechanism, which I think is more primary. They create dysbiosis, imbalance between the microbiome of the gut, where we all have a certain amount of naturally occurring yeast in our gut, but when it overgrows, it becomes opportunistic, creates inflammation, creates gases, creates havoc in the digestive system, hinders absorption, and so this yeast, candida, fungal overgrowth then also worsens this leaky gut which is occurring.
Do we have a spackle? Don't try that at home. Do we have a spackle? If you ever pull a picture out of the wall and you got a hole there, so you spackle over it. Is there such a thing as something we drink that would help seal up the gut?
There are. For example, aloe has been shown. You can get food-grade aloe you can take, or you can take it in supplements. Slippery elm, you can take teas, you can take lozenges, capsules. That helps to heal it up. So there are some natural things people can do to heal up that leaky gut, which we highly recommend to a lot of our patients.
I read one time that mothers who breastfeed, colostrum, you know, the first of the milk, tend to have fewer difficulties with gut leakage. Do you know anything about that? Might that?
Well, yes. The infants who are breastfed, they have a healthier gut lining, that is true, and their immune system functions more normally, and they have less food sensitivities. You know, we've all talked to people and they have multiple food sensitivities. They can only eat maybe 5 or 6 foods. They're reacting to everything. Almost all of these cases is due to leaky gut, where your immune system is hyperreacting to all these particles in your gut because your small intestine is not healthy.
We really have to be responsible for our own health. And we could talk about 20 different things, and we will. While I have you here in Dallas, I want to talk with you and Angela, your wife, both NMDs. I want to talk to both of you about how we maintain good health. At my age, I feel just blessed, you know, with having health like this. What is the one thing you would say in all the thousands of patients you have seen that people can do to take back responsibility for their good health?
Well, it's what I've seen, what the studies have shown. I mean, there's many factors, but one that always comes up in the literature, what we see with patients, and that's improve your diet. Because think about it, our body doesn't work by magic, our cells aren't made by magic. You need the proper nutrition for everything to function properly. So by improving diet, you essentially can improve everything in the body.
Thank you. I've referred many people to you and your wife, and thank you for what you two do. Folks, for more information, it's Dr. Stengler, Stengler, drstengler.com. Thank you for coming in today.
Thank you.
I really appreciate you. My career has been such a blessing. Along the lines, I met Dr. A.V. Costantini, who wrote the book Prostate Cancer, Hope at Last. The whole book is on fungus. And I met the doctor who discovered the PSA, the great prostate hoax he wrote, how big medicine hijacked the PSA test and caused a public health disaster. Agree 150%. That's why I interviewed him on my show. And I'll quote these books. Prostatitis, okay, I don't have a urologist. I've never been to a prostate doctor, and I'm an old guy. Prostate, it sounds sore. Prostatitis, ouch, I put. According to the Mayo Clinic, swelling the prostate can cause these things: pain and burning while urinating, difficulty urinating, dribbling, hesitant urination, frequent urination, you're up at night, urgent need to urinate, cloudy urine, blood in the urine, pain in the abdomen, groin, or lower back, pain in the area between the scrotum and rectum, pain or discomfort in the penis or testes, painful ejaculation, and flu signs and symptoms of bacterial prostatitis. Wow. I would hate to have this problem. So, prostate problems, how does a man know, right? Generally, a man with symptoms, any of those, will visit a urologist who will take a history and do a digital rectal exam and a PSA. According to the website Urology Web, despite a standard FDA approval resting primarily on whether a device is safe and effective, the highly ineffective PSA and its 97% false positive rate was given FDA approval in 1994. I'm falling out of my chair. What have we learned? The mammogram is 58% effective. This is almost 20% effective, and all men are lining up and doctors are happy to do this test. Folks, really we need to think about this. How do I keep my prostate? How do I keep the breast tissue? How do I stay healthy? You've been watching Know the Cause for quite a while. How does a man know? This means that over 3 of 4 men who had a PSA test got the wrong results. The test results were positive when they should have been negative. Couple this with the false negative rate of the PSA test, and the test is highly unreliable. Unbelievable. Reliable PSA test. WebMD says this back a few years ago: the PSA blood test is commonly used to check for signs of prostate cancer or other prostate problems. When a PSA level comes back high, the next step is often a biopsy. But a new study, I love this, suggests another course of action, another PSA test done more than a month down the line. That's because a PSA level can fluctuate up and down, so a man with a high PSA level may not actually have any prostate problems at all. Thank you. In fact, after studying nearly 1,000 men, researchers found that about half of those with PSA levels were initially high had a normal result in a subsequent test. Thank you. Why? Why did this take 50 years to learn? Who's working in our best interest? How big medicine hijacked the PSA test and caused a public health disaster. Okay, let's keep going. Doctors are always looking for bacterial prostate infections, but rarely for fungus. And yet principles and practice of clinical mycology said 25 years ago, yeast species are the most common fungi that infect the urinary tract and hence the commonest cause of fungal prostatitis. Guys, yeast. Are we passing this back and forth? Okay. Fungal prostatitis, the role of fungal infections as a causative factor for prostatitis is currently underestimated, says the European Journal of Urology. And finally this, might the PSA test be a fungal test? My good friend Dr. Costantini published this. Structurally, the PSA molecule is a 33 kilodalton serine protease, that's a big way of saying an enzyme, which was found to be produced by 5 fungi, all of which are sac fungi. The doctor does a digital rectal exam and he feels, like on your knuckle right here, a little sac, but on this muscle right here, it feels normal. That's what a normal PSA or a normal prostate exam feels like. Doctor feels a lump. These are sac fungi that can grow in a nodule, in a lump. What's going on here? All I'm saying is please, please, be careful out there. Noted pediatrician, loved here in the state of Texas, Randy Naidoo, medical doctor, joins me right now. Welcome to the show, Dr. Naidoo. Thank you for being here. Complementary or integrative. I never heard those 2 words with the word pediatrician. It's like a pediatrician does this, but an open-minded pediatrician listens, then talks, right? Welcome to the show. As a pediatrician with the massive practice that you all have, what are some of the things you're seeing now the past few years? Are you still ear infections and bronchitis and so forth?
Yes, our practice is just like any other pediatric practice in terms of the presentations of illnesses. I think the one thing, again, that's maybe a little bit more unique with our practice is that we see kids have, I think, a better resiliency to handle those infections, maybe without the traditional medications. I think sometimes something just as simple as garlic ear drops or antiviral support can help through a upper respiratory infection or an ear infection. We see tons of sore throats. Some of those are strep related where an antibiotic is necessary, But what do you do when the strep test is negative? What kind of recommendations do you give? Do you just tell the child to just go home and take some Tylenol or Motrin?
Right.
Or are there other beneficial things that you can do, like certain herbals or homeopathics, to help support that child through that?
See, that's why you're called Shine.
And the interesting thing, Doug, is, you know, when I was in the Air Force, I was the officer in charge of the vaccine clinic, and I used to handle all of the allergy patients, asthma patients. And I had this really grandiose idea that I was going to be this great doctor when I got out and take care of all of our asthma patients and, you know, make sure they're on their steroid inhalers and those kind of things. But I'll tell you what, over the course now, since 2010 to now, I just don't have a lot of children that have severe asthma. And that has been a blessing, because that can actually take a child's life if they are in that extremis of having breathing issues. So we've been very fortunate to kind of see that over the years of having less of these asthma-related issues.
See, this is so important. I'll never forget, Jay Gordon was our pediatrician, you know, many years ago out in California. And I had to call him at night one time because the little guy was kind of feverish and he was pulling his ear. And I said, Dr. Gordon, I think he's got an ear infection. He said, okay, tell Ruth 2 words, bend over. And I said, okay, do tell. Breast milk. A couple drops of breast milk in the affected ear. And do you know, by the next day, he was healed.
Yeah.
I mean, it's just the way God built this is amazing. And yet, pharmacy. I love your approach to these things. Now, you will concur with me, I'm sure. Sometimes an antibiotic can be life-saving.
Yes,
you know,
there's a place for it.
Anti-seizure medicine can be life-saving. But for the most part, you're trying to help people. How much of a role does diet play in a child's health?
A significant role, Doug. I mean, you know, I was just thinking about this driving to the studio, and maybe it's the Holy Spirit kind of revealing this, is I think our bodies are energetic. The more energy that is put into the body to create a disease process, i.e. trauma like a motor vehicle accident or some kind of high velocity, the amount of pathology that is caused by that high amount of energy, you need more traditional things to get that body back in order.
Good point.
But if the energy that is input into that body is very minimal and it's causing certain disease processes, maybe the amount of energy that we need to put into it doesn't have to be that much.
Are the Israeli children going to require you know, some of these traditional approaches because of the trauma they have experienced?
Significant. I mean, any child that goes through a high velocity trauma, they're going to need more care. Some of it is going to be conventional.
And I agree with you 100%, because we got to experiment like you do with your 3 kids. And that is, we experiment with diet. When they go spend a night at a friend's house, Ruth used to make broccoli. And if you're going to drink that soda and eat that pizza, you know, when you get home, we got a picture of our youngest son with a frown on his face with broccoli coming. How much more of this do I have to eat? Folks, if you'd like more information, Shine Pediatrics, S-H-I-N-E, Sunshine Pediatrics, .com, the Wellness Center. Thank you for what you do. I'm not saying this because you're here with me, but you are loved. Thank you for what you do. You think outside of the box. You really do.
Thank you, Doug.
God bless you. Thanks. So we touch on issues, right, like breast cancer, prostate cancer, and so forth. It's imperative that you understand, keep me safe on TV. It's imperative that you understand, always work with your own doctor. All I'm doing is planting seeds so you know this. The PSA, your doctor will tell you, is not totally reliable. And DCIS, your doctor will probably tell you, well, it can become bad. It may not be bad yet. Always work with your doctor. Did you know, by the way, that every Monday and Tuesday from 3 to 4 p.m. Central Time, I go live to answer your questions? You can go to my website, knowthecause.com, or you can go to my Facebook page, and I'll answer your questions. Thank you, doctors. Thank God for you folks. Take care. Bye-bye.
The preceding program, Know the Cause, was paid for by Mediatrition Incorporated.